You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 1-year-old neonate presents with a 2 to 3 centimeters defect, actually a small defect, on the anterolateral wall of the abdomen. Now, seen through this defect was some portion of the intestine. But my friends, the intestinal content seen through it was not covered by any translucent membrane. So this is the case study, yes, before us, and we are supposed to, yes, think through it and of course answer these questions. So the first question I have for you is that, looking at the presentation of this neonate, what is the most likely diagnosis of the condition? My friends, your answer is gastroschisis. Gastroschisis. That is the condition that this patient, yes, this neonate actually is presenting with. Now, number two, where's the second question? We want to also understand, yes, what made you, yes, give this answer as a diagnosis of this neonate's condition. So in other words, we want to understand the peculiar characteristic features of gastroschisis. And my friends, your first answer is that, yes, the defect, yes, it's a small one. Usually it usually measures 2 to 4 centimeters. It doesn't go beyond 4. Usually it's a small defect, and it's located on the anterolateral wall of the abdomen. That's number two. And of course, usually it's towards the right of what we call the umbilicus, the belly button. Yes, that's what usually we see. And the third important characteristic feature that you should know about this gastroschisis is that it will not be covered by a translucent membrane. Okay, so there will not be any peritoneal sac covering this herniation. So these are the three important characteristic features that we find with, of course, gastroschisis. The reason is that it can be confusing with omphalocele. Because with omphalocele, what happens is that the defect is at the base of the umbilical cord. That's what we see. And it's also a midline defect. And then what we see is that it will be covered by what we call a translucent membrane, okay, by way of the peritoneal sac. And so once we are not seeing these ones, and based on the presentation being laterally placed, is that okay, lateral to the umbilicus, okay, in the anterolateral wall of the abdomen, and then of course the hernia that we see, yes, it's not covered by any peritoneal sac, and the defect is a small one. In this question we said 2 to 3 centimeters. Okay, now question number 3 is that I want to understand if this, talking about this, gastroschisis, if it's left unattended to promptly, what will be the complications? We want to understand what will be the complications that, of course, this neonate is going to experience if left, unattended to promptly. And my friends, the first thing that we will talk about is that because it's not covered by any peritoneal sac, then exposure to infections is so high. So this patient or this neonate is most likely going to die, okay, from a secondary bacterial infection. So a lot of bacteria exposed to it and of course invading this area. So infections, number one. And then number two, the fact that, yes, it's coming out through a small defect, okay, on the anterolateral wall of the abdominal wall, abdomen. What you should understand is that there's that high chance of what we call, intestinal obstruction, or even strangulation can take place. So intestinal obstruction is also one of the things that we can see. And my friend, no doubt that, yes, it may have some kind of issue as far as the respiration of this newborn is concerned. Respiratory distress is also one of the things that, yes, you can see. But my friends, if you've seen this, then how do we manage it? How do we manage it? Okay, the typical management of this condition. Okay, so what happens is that there should be a surgical repair within 48 hours of extrauterine life. You have to quickly, first of all, you have to return this hernia, okay, or reduce the hernia, send it back to, of course, the abdominal cavity, and then again we have to, of course, repair this, of course, defect, and then push, surgically we have to manage this, patient very well, so that, of course, all those complications will be minimized. Now, the good news about this, gastroschisis, is that if it is promptly, yes, this hernia within 48 hours, it is promptly repaired, then what happens is that the prognosis is good. So about more than 90% survival rate if it's done properly and it's uneventful, let me put it that way. If it goes on without any further complications, then what will happen is that this newborn can survive. Okay, very well in this new extrauterine life that it finds itself. My friends, so this is what we discussed today, and I believe that you find it helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.